Hey everyone, welcome back to Speak Healthy. Today, we are going to talk all about diabetic retinopathy so that you all can grasp a better understanding of it. Diabetic retinopathy is a complication of diabetes that affects the eyes and is one of the leading causes of blindness in adults. It occurs when high blood sugar levels damage the blood vessels in the retina, leading to vision problems and even vision loss. Understanding diabetic retinopathy is crucial for individuals with diabetes, as early detection and treatment can prevent or delay the progression of the disease. In this video, we will explore the causes, symptoms, and treatment options for diabetic retinopathy, as well as discuss the importance of regular eye exams for individuals with diabetes. Number 1. Definition and prevalence of diabetic retinopathy. Diabetic retinopathy is a condition that develops as a complication of diabetes and affects the eyes. It is caused by damage to the small blood vessels that nourish the retina, the light-sensitive tissue at the back of the eye. High blood sugar levels can cause these blood vessels to leak, swell, or close off, leading to vision problems and potentially blindness. Diabetic retinopathy is one of the most common eye complications of diabetes, and its prevalence increases with the duration of diabetes. According to the National Eye Institute, around 40 to 45% of people with diabetes have some form of diabetic retinopathy. Additionally, diabetic retinopathy is more common in people with type 1 diabetes, which is typically diagnosed in childhood or young adulthood, compared to those with type 2 diabetes, which is more common in older adults. The impact of diabetic retinopathy on an individual's quality of life and independence can be significant. In the early stages of the condition, individuals may not experience any noticeable symptoms. However, as diabetic retinopathy progresses, it can cause blurry or distorted vision, difficulty seeing at night, blind spots, and eventually complete vision loss. These visual impairments can make it difficult for individuals to perform daily tasks such as reading, driving, and even recognizing faces. This can have a profound impact on their independence and ability to engage in social activities, work, and other daily tasks. It is important for individuals with diabetes to be aware of the potential risk of diabetic retinopathy and undergo regular eye exams to catch the condition early before it progresses to more severe stages. This can help prevent or delay vision loss and can preserve an individual's quality of life and independence. Additionally, managing blood sugar levels, blood pressure, and cholesterol, as well as quitting smoking and adopting a healthy lifestyle, can help reduce the risk of diabetic retinopathy and other complications of diabetes. Number 2. Causes and risk factors for diabetic retinopathy. Diabetic retinopathy is caused by damage to the blood vessels in the retina, which can be attributed to high blood sugar levels. When blood sugar levels are consistently elevated, it can cause damage to the blood vessels throughout the body, including those in the retina. This damage can result in weakened and leaky blood vessels, which can lead to swelling and fluid accumulation in the retina. In response to this damage, new blood vessels may begin to grow in the retina, but these new blood vessels are often fragile and prone to bleeding, leading to further vision problems. In addition to high blood sugar levels, there are several other factors that can increase the risk of developing diabetic retinopathy. These risk factors include duration of diabetes. The longer a person has had diabetes, the higher the risk of developing diabetic retinopathy. After 20 years of diabetes, nearly all individuals with type 1 diabetes and over 60% of those with type 2 diabetes will develop some form of diabetic retinopathy. Poorly controlled blood sugar levels. Individuals with poor blood sugar control are at higher risk of developing diabetic retinopathy compared to those with good blood sugar control. High blood pressure. Hypertension, also known as high blood pressure, can damage the blood vessels in the retina and increase the risk of diabetic retinopathy. High cholesterol levels. Elevated levels of cholesterol and other lipids in the blood can contribute to the development of diabetic retinopathy. Smoking. Smoking is a risk factor for many health problems, including diabetic retinopathy. It can damage the blood vessels and make diabetic retinopathy worse. Pregnancy. Women with diabetes who become pregnant are at increased risk of developing diabetic retinopathy, especially if their blood sugar levels are not well controlled during pregnancy. It's important for individuals with diabetes to be aware of these risk factors and take steps to manage their diabetes and maintain good overall health to reduce the risk of developing diabetic retinopathy. Regular eye exams are also crucial for detecting diabetic retinopathy early and preventing vision loss. Number 3. Symptoms and stages of diabetic retinopathy. The early stages of diabetic retinopathy may not cause any noticeable symptoms, which is why regular eye exams are important for detecting the condition. However, as the condition progresses, the following symptoms may occur: blurred or distorted vision, fluctuations in vision, impaired color vision, dark or empty spots in the visual field, difficulty seeing at night, vision loss. There are 4 stages of diabetic retinopathy: mild non-proliferative retinopathy, moderate non-proliferative retinopathy, severe non-proliferative retinopathy, and proliferative retinopathy. In the mild non-proliferative stage, small areas of swelling may occur in the blood vessels of the retina. These areas may leak fluid or blood, causing blurriness in the vision. In the moderate non-proliferative stage, the blood vessels in the retina may begin to swell and distort, leading to a decreased blood flow. This can result in areas of the retina being deprived of oxygen and other nutrients. In the severe non-proliferative stage, a significant number of blood vessels in the retina become blocked, which can lead to widespread retinal damage and vision loss. In the proliferative stage, new abnormal blood vessels may start to grow in the retina and the vitreous gel that fills the eye. These new blood vessels are fragile and prone to bleeding, which can cause vision loss and even blindness. The symptoms and stages of diabetic retinopathy can progress over time, with more severe stages leading to more significant vision loss. In the early stages, diabetic retinopathy may not cause noticeable symptoms, and the condition can progress slowly over several years. However, as the condition progresses to more severe stages, vision loss can become more significant and may be irreversible. It's important for individuals with diabetes to undergo regular eye exams, especially if they are experiencing any symptoms of diabetic retinopathy or have any risk factors for the condition. Early detection and treatment can help prevent or delay vision loss and preserve an individual's quality of life. Number 4. Diagnosis and screening for diabetic retinopathy. Diabetic retinopathy is diagnosed through a comprehensive eye exam that includes several tests to evaluate the retina and other structures in the eye. During an exam, an eye doctor may perform the following tests to diagnose diabetic retinopathy. Visual acuity test. This test measures how well an individual can see at different distances. Dilated eye exam. The eye doctor will put drops in the eyes to dilate the pupils, allowing them to examine the retina and other structures in the eye for signs of diabetic retinopathy. Tonometry. This test measures the pressure inside the eye, which can help detect early signs of diabetic retinopathy. Optical coherence tomography. This test uses light waves to create detailed images of the retina, which can help detect swelling or damage. For individuals with diabetes, regular eye exams are crucial for detecting diabetic retinopathy early and preventing vision loss. The American Diabetes Association recommends the following eye exams for individuals with diabetes. Type 1 diabetes. Individuals with type 1 diabetes should have an eye exam within 5 years of their diagnosis and then an eye exam annually thereafter. Type 2 diabetes. Individuals with type 2 diabetes should have an eye exam at the time of diagnosis and then have an eye exam annually after. Pregnant women with diabetes. Pregnant women with diabetes should have an eye exam during the first trimester and then be monitored regularly throughout their pregnancy. If an individual is diagnosed with diabetic retinopathy, the frequency of eye exams may be increased to monitor the condition and prevent further vision loss. Treatment options for diabetic retinopathy include laser treatment, injections of medication into the eye, and surgery. Individuals with diabetes should undergo regular eye exams to screen for diabetic retinopathy and detect it early when treatment options are more effective. The recommended frequency of eye exam varies depending on the type of diabetes and other risk factors such as pregnancy. Number 5. Treatment options for diabetic retinopathy. There are several treatment options available for diabetic retinopathy depending on the severity of the condition and the specific symptoms that an individual is experiencing. These treatment options include laser treatment. This treatment involves using a laser to seal leaking blood vessels in the retina or to shrink abnormal blood vessels that are causing vision loss. Injections of medication into the eye. Medications such as antivascular endothelial growth factor, drugs, or steroids may be injected directly into the eye to reduce swelling and inflammation in the retina. Vitrectomy surgery. This surgical procedure involves removing the vitreous gel from the eye and replacing it with a clear fluid. This can help improve vision if the vitreous gel has become cloudy due to bleeding or other complications from diabetic retinopathy. The goals of treatment for diabetic retinopathy are to prevent or delay vision loss, reduce the risk of complications, and preserve an individual's quality of life. Treatment may also be aimed at reducing the progression of the condition or reversing some of the damage that has already occurred. The effectiveness of treatment options for diabetic retinopathy varies depending on the severity of the condition and the individual's overall health and other factors. Laser treatment and injections of medication into the eye have been shown to be effective at preventing or delaying vision loss in many individuals with diabetic retinopathy. However, these treatments may need to be repeated over time to maintain their effectiveness. Vitrectomy surgery may be more effective at improving vision in individuals with more advanced stages of diabetic retinopathy. It's important to note that while these treatments can be effective, they are not a cure for diabetic retinopathy. Individuals with diabetes should work closely with their healthcare providers to manage their blood sugar levels and other health conditions to help prevent or delay the onset of diabetic retinopathy. Regular eye exams are also essential for early detection and treatment of diabetic retinopathy. Number 6. Prevention and management of diabetic retinopathy. Prevention and management of diabetic retinopathy require a comprehensive approach that includes both medical and lifestyle interventions. Here are some steps individuals with diabetes can take to prevent or delay the development of diabetic retinopathy. Manage blood sugar levels. Keeping blood sugar levels within a healthy range is the most effective way to prevent or delay the onset of diabetic retinopathy. This involves regular monitoring of blood sugar levels, taking medications as prescribed, and making lifestyle changes to support healthy blood sugar levels. Manage blood pressure and cholesterol. High blood pressure and high cholesterol levels can also increase the risk of diabetic retinopathy. Managing these conditions through medication and lifestyle changes can help prevent or delay the onset of diabetic retinopathy. Quit smoking. Smoking can worsen the damage caused by diabetic retinopathy and increase the risk of vision loss. Quitting smoking can help prevent further damage and improve overall health. Attend regular eye exams. Individuals with diabetes should have regular eye exams to detect diabetic retinopathy as early as possible. This allows for early treatment and can help prevent further vision loss. In addition to these steps, individuals with diabetic retinopathy can also take steps to manage their condition and prevent further loss. These steps may include: follow a treatment plan. Working closely with healthcare providers and following a treatment plan can help prevent further vision loss and manage the progression of the condition. Monitor blood sugar levels. Regular monitoring of blood sugar levels can help manage diabetic retinopathy and prevent damage. Maintain a healthy lifestyle. Eating a healthy diet, exercising regularly, and managing stress levels can all help manage diabetic retinopathy and prevent further damage. Attend regular eye exams. Regular eye exams are important for monitoring the progression of diabetic retinopathy and detecting any changes that may require treatment. Preventing and managing diabetic retinopathy requires a comprehensive approach that includes both medical and lifestyle interventions. Managing blood sugar levels, attending regular eye exams, and making healthy lifestyle changes are all important steps in preventing or delaying the onset of diabetic retinopathy and managing the condition to prevent further vision loss. Diabetic retinopathy is a common complication of diabetes that can lead to vision loss if left untreated. Early detection and treatment are crucial for preventing further damage and preserving vision. While there is no cure for diabetic retinopathy, there are a variety of treatments available that can slow or stop the progression of the condition. Additionally, individuals with diabetes can take steps to prevent or delay the onset of diabetic retinopathy by managing their blood sugar levels, blood pressure, and cholesterol, quitting smoking, and attending regular eye exams. By taking a comprehensive approach to prevention and management, individuals with diabetes can protect their vision and maintain their quality of life.